In any health facility, sepsis is the most important cause of neonatal deaths. Therefore, it is important for each hospital to take necessary steps to prevent neonatal sepsis. The first and the foremost important step in prevention of nosocomial infections is hand washing. Hand washing should be done for at least 2 minutes before entering the unit and for 20 seconds after touching the babies. Each unit should have adequate facilities for hand washing, including running water supply, elbow-operated taps, and soap. Remember, only elbow-operated taps should be used for hand washing. This is not ideal for hand washing because there is no elbow-operated tap. Also, the sink is not deep enough to allow proper hand washing. It has an elbow-operated tap and a deep sink. This is more suited for hand washing. Before washing the hands, remove the wristwatch, bangles and ring and roll sleeves above the elbow. Wet your hands and apply soap until the elbow. Now, close the tap and start washing your hands in the following sequence. First, palms, fingers and web spaces. Back of hands, fingers and knuckles, then the thumbs, fingertips, and lastly, wrists and forearms up to elbow. Now, wash the hands and close the tap using your elbow. Note: after washing your hands, always keep them at a higher level than the elbow. Dry the hands by using sterile napkin or autoclave sheets of newspaper. Discard the napkin in the black bag. Keeping the bed of the baby and the surrounding area clean is an important step in prevention of neonatal sepsis. Remember, the bed should be prepared before the baby is admitted to the nursery. For preparing the bed, we need 2% bacillocid and soap water. 2% bacillocid is prepared by mixing 2 ml of bacillocid in 98 ml of distilled water. Use the prepared bacillocid solution to clean the bassinet of the radiant warmer. The side panels of the warmer should be cleaned with soap and water. Thereafter, wipe both the bassinet and the side panels with a sterile dry cloth. After drying, take an autoclaved baby sheet and spread it over the bed. Use another sheet to prepare a boundary for the baby. Clean the temperature probe of the warmer with a spirit swab and switch on the warmer. Now the bed of the baby is ready. Next step is to keep the baby belongings ready at the bedside. They include stethoscope, measuring tape, thermometer, and containers of spirit and betadine swabs. Note: each baby should have a separate set of all the items. Clean the stethoscope and the measuring tape by using spirit swabs. The thermometer should also be cleaned by spirit swab. Wash the containers of spirit and iodine swabs with soap and water and then wipe them dry with a sterile cloth. Put autoclave swabs in the containers. Pour spirit and povidone iodine over the swabs. Close the container and put a date. These swabs should be used within 24 hours. Now we are ready to receive the baby in the nursery. The following measures would help in prevention of nosocomial infections after the baby is admitted in the nursery. They include adherence to strict aseptic precautions for any invasive procedures, avoidance of overcrowding, avoiding unnecessary use of intravenous fluids, and promoting breastfeeding. Now we shall see the daily housekeeping routines. The walls of the unit should be cleaned daily by using 2% bacillocid. The floor is cleaned with diluted phenyl once per shift. Remember, only wet cleaning should be done. Do not use dry mopping. The radiant warmer and incubator should be cleaned daily by using soap and water. Clean the bassinet of the weighing machine daily and after each use by using 2% bacillocid. The display panel is cleaned by using soap and water. Syringe pumps should be cleaned daily with a wet, clean cloth. If it becomes blood-stained, use soap and water. Feeding utensils like paladay and katori spoon should be disinfected before and after each use. For disinfection, first wash with soap and water, then boil them for about 20 minutes. Oxygen hood should be washed daily with soap and water and then wiped dry by using a clean cloth. The probe of the pulse oximeter is cleaned with a spirit swab. The display panel should be cleaned with soap and water. Clean the ambu bag with soap and water. Immerse in 2% glutaraldehyde for 4 to 6 hours. Then rinse in distilled water. Dry and wrap in autoclave linen and put a date. Ventilator tubings are first cleaned with soap and water, then immerse in 2% glutaraldehyde. Remove after 4 to 6 hours and rinse in distilled water. Dry and wrap in autoclave linen, then put a date. These items can be used up to 72 hours, after which they have to be cleaned again, as explained. By following these simple steps, we can prevent nosocomial infections to a significant extent in the neonatal unit.